collection of consecutive pulses. And you can control the number of pulses inside that train, and you can control what's called the inter-train interval, which is the time which the device has to stop between trains, actually for the safety of the patient. These are safety measures that you have to know very well how to control and how to select for your patient, because there are actually well-known, now well-established safety measures. So for example, you cannot, if you are going for a higher frequency, like 20 Hertz for example, you have to make the number of pulses in a train shorter and the inter-train interval longer, and so on. So it has some safety measures. This is a diagram to show you the same idea. So these are the pulses. This vertical lines represents the pulses, and this is a train, a group of pulses, and then you have the inter-train interval, and then another train, and so on. This is a diagram that represents a TMS session. So how does it work? The main idea of the TMS, or the main aim of TMS, is actually to promote compensatory or beneficial plasticity changes, or plastic changes, and to inhibit the unwanted maladaptive plastic changes. The advantage of TMS is that it can do this in a focused manner, in a targeted manner, because you're actually directly working on the cortex without causing so much systemic side effects and so on. It's a local form of therapy. Some key facts that's important to know about rTMS is that sometimes from the name you get the idea that it's only for stimulation, because the name is transcranial magnetic stimulation. But actually it can inhibit as well, and this depends on the frequency. You can do this using the frequency. If you use high frequencies, more than 5 Hertz, this is called a stimulatory rTMS, or high frequency rTMS, and this actually leads to increased cortical excitability. But if you use low frequencies, like 1 Hertz or below, this causes a decrease in cortical excitability. Another fact is that rTMS sessions do not need sedation or anesthesia or whatsoever. Something else that's very important to know is that the effect of stimulation goes beyond the point of stimulation. So you are actually not usually, we think of TMS as, you are stimulating a center or a certain Boltzmann area. This is not correct actually. You are dealing with circuits, right? So, for example, if you want to stimulate the